Hi, everybody, and thank you so much for joining me in this new venture that I'm trying. This is Dr. Millie Lytle. I'm a naturopathic doctor and a coach, a personal growth coach and relationship coach, and I want to thank you for joining me here. I have been away from Facebook for quite a number of years, actually, and this group, Chronic Disease Prevention, has been kind of steadily but silently growing, and I just started managing it a little bit. It had gotten kind of unmanaged and out of hand for a while, and so I've cleaned it up, and I'm participating as my Dr. Millie page, the NatMed coach page, as well as the chronic disease prevention group. Please do feel free to ask questions in the chat. This is for general education and information purposes only. Of course, I am not, answering medical advice here on this chat, but I do want people to be able to touch base with me and have their questions asked. So I thought I'd just kind of come live every week and present a topic of conversation related to chronic disease and or chronic disease prevention primarily. That could be anything from, something about certain diseases, symptoms that you might be having, uh, just general questions about what we mean by chronic disease prevention. And I did actually post a poll, and I know some people have voted already. So please, if you could vote in the chronic disease prevention group, this is a public group. You can just join easily. I do moderate people who post comments though, but if you just go to that page and take the poll and just let me know what you're interested in hearing about. And so the options are mind body connection and mental health, weight loss, nutrition and supplements, exercise and fitness, symptom control, blood sugar and diabetes, general health and healing, blood pressure and heart disease, natural disease treatment, or other. And so if you want to post anything else that you'd be interested that I have not posted here, then please feel free to just add that as an option, and I'll certainly take that into consideration because I'm looking forward to connecting with you here in this group, and I hope to make this group really active. I know there are some practitioners in this group. I know there are some people who potentially have products or tools or devices. And I know that there's some people who are just here to consume and to be educated and be part of a community. And so that's great. I have also set up a chat, a community chat. It's just a general community chat. And so if you post there, I will be managing that and just make sure to follow along, see what people are posting, and I'll answer those questions. I will tailor it so that there's, according to the guidelines. So please do read the rules. I've reposted those. This group, be kind and courteous, no hate speech or bullying, no promotions or spam or repetitive posting, respect everybody's privacy. I know when it comes to healthcare and symptoms, people might want to share things. And if you don't want to share things, you want to DM me, that's also absolutely fine. I'm happy to set up a call. I'll send you a link to my calendar so that you can have a road mapping session with me. And there's no nudity or sexual content permitted in this group. And just so you all know that general content does not replace medical advice. I'm not giving medical advice on this channel. But I will be answering questions, as personal as we and as individual to you as we can manage. But I would never be able to give you those recommendations as a physician, like as your doctor. I'm not your doctor just because we're participating or speaking in this group. And so as long as everybody's clear on that, I'm giving away a free guide, and I posted and pinned this in the chronic disease prevention channel. 4 surefire ways to change your body without giving up everything you enjoy. I think people often think that in order to get healthy or in order to prevent disease, they need to change everything that they're doing. And this is really not so. Not only is it impossible to change everything about your life at one point, even if all the experts and all the authorities are saying that you need to do these 20 things, you can't possibly do all those 20 things at once. And in fact, when you take on a few, and even among these 4 that I'm presenting in this guide, you can pick and choose. You might be doing 1 or 2 of them already, you might be doing all of them already and then want to deepen your practice of them, or you might not be doing any of them and really just want to focus on adding 1 in. Because I will tell you that, especially if you've been living with maybe undiagnosed chronic disease or subclinical chronic disease, or just kind of feeling bad, if you're feeling kind of not your best, then once you make 1 or 2 of these changes, then you'll start to feel better. And when you start to feel better, then it motivates you to do more. You see the results, you see that the proof is in the pudding, you see that this can work for you. And it also allows you to find out, what thing did I do that's making me feel so much better? I also want to speak to the misnomer that people think that just because they're doing things that are considered unhealthy or bad, that there's no way that they can do anything good, because everything bad they're doing is taking away from all the good things. And I have to say that this is absolutely not true, that we all have to find our own balance. And that's actually even more important. It's impossible to do everything correctly. I personally am, I feel, some people might think that I'm extreme because I've been living, as a naturopathic doctor for 25 years and, have been focused on health, but I'm an absolute moderate. And I like to, have my wine, and I do eat red meat, and I like to enjoy myself, and I do, restrict or reduce or limit certain things. But it's not all across the board. I really enjoy my time out at restaurants. I enjoy cooking. I enjoy eating at my friend and family's place. I enjoy eating at restaurants. And, I right now I am training for a half marathon, so I am running 5 days a week right now. But I fall off the wagon. Sometimes I'm not. Sometimes I really have to get myself back on, to the gym, or doing some yoga practice, or doing deep breathing, or even just getting myself to bed early. So chronic disease prevention is not about being perfect forever. It's about identifying, what's not working in your life, and getting some expert guidance if necessary to help you, identify, pick and choose what things you could be doing, you could be adding in, that's going to create a new balance for you, a better balance that is working for you, that is allowing your body to work better. And our bodies and our minds, our mind is part of our body. Our body and our mind are absolutely connected. They're connected through the digestive system. They're connected through the nervous system. They're connected through our blood and oxygenation, the oxygen that flows through all of our tissues. They're connected through the memory of all of our cells, through our microbiota, our bacterial organisms. So our mind and our body are absolutely connected. So every time I'm talking about the body, I am also talking about mental health. Although in the poll, for instance, that I was discussing earlier, what topics are you most interested in? Mental health, mind, body connection are there together, because I do want to be sure that people know that we're also talking about anxiety, depression, mania, even psychosis at times can be influenced by lifestyle choices and things you're doing, and that you can bring balance into that area of your life. Absolutely. Whether you're on medication or whether you're not on medication. I do certainly love to talk about supplements, and that's something that I will be discussing, but also food, also physical fitness, mindfulness practices, personal growth and development. Ultimately, I've been a naturopathic doctor for 30, I'm trying to remember I do think I've been a naturopathic doctor for 20 years and 22 years. Oh God, whew. I thought it was 30 years for a second. And so that's a long time. And I have been in this field for even longer than that. And I've worked in a number of clinical situations in different clinics. I've worked with online digital health. I've had my own company. I've worked for an autoimmune startup. I have worked in supplements and retail. I've also worked in research. I've worked in mental health. I've worked in women's health, and primarily have focused on women's health in the majority of my career, or at least women have been the biggest consumers of naturopathic medicine, which is not to say that it can't help men. It absolutely can help men. But it is something that you need to take initiative to start doing. So the first thing that you can do in order to benefit from the content that I'm providing to you is to find the post where I'm giving away a free guide for 4 surefire ways to change your body without giving up everything that you enjoy. Drop the word prevention in the comments to grab yours, and I will DM you, and that'll start our conversation. I will also be promoting certain courses, digital courses, internet-based courses on a platform that you can take the modules. That will be coming up fairly soon, and I will certainly make that announcement. But I'm also just here to share and get to know you and to discuss and to highlight and elucidate what this topic of chronic disease prevention means. Does this mean that if you're sick already that you can't be working on prevention? Well, you can be working on preventing other conditions. I would say that many techniques, naturally driven techniques to prevent chronic disease, are also similar ones to treat. However, they are more foundational when we're still working with prevention. When we're working with prevention, you might still have symptoms, and symptoms can be some of the most notable, the way that your body is communicating with you and telling you, hey, pay attention, pay attention. And if you're at that stage where you have symptoms and your body's saying, pay attention, then this would be probably the ideal time to be focused on this content. If you haven't reached the place where you have any symptoms yet, you're actually very healthy and you're just inquiring and just kind of investigating other healthy approaches so that you can focus on health and longevity and preventing chronic disease at an earlier stage, then absolutely this content is great for you. If you're at a place where you are already sick and or have been diagnosed with a condition and are already taking medical treatment or deciding what treatment, and you're kind of perusing and considering your options, then I would say that this content is good for you because it can help prevent future things, and it can help inform you as to some options that you might have, how you can take control of the situation or talk with your doctors about the situation. But it also might not be specifically focused on the condition that you have, which might be important. In the natural world, it is true that, and you might have, when I say chronic disease, what am I talking about? I'm talking about disease that might affect any organ and or body system, or multiple organs and or body system, and yet you might have a specific, heart disease or liver or kidney disease or immune disease, and so you might need something that's more specific. And so that's when we definitely want to engage in a conversation, or you might want to seek other support that's more specific towards for your condition. However, many strategies that we take in the natural world can help with prevention and with treatment. But it is also important that you address things quickly if you're at that place where you kind of need a quick turnaround. So chronic disease prevention, I would say, is a little tricky to measure, because if we're truly preventing disease, all we can do is assess over our lifetime how we recover from, acute illnesses that we might have, or whether or not we ever end up developing a chronic disease. And, time will tell that those who follow a healthy diet, exercise regularly, maintain a healthy weight, think positively and proactively, take control over your health. These are some ways that have been shown to prevent chronic disease. So preventing chronic diseases does involve adopting, healthy lifestyle habits. And this doesn't mean you have to adopt the perfect lifestyle habit. but making proactive choices to maintain overall health and well-being, honing in on those symptoms that you're experiencing and seeing if we can naturally remove the causes of those symptoms and get down to and stop the disease process that's happening. And these key strategies tend to be, changing up your diet, maintaining a healthy weight, staying physically active to whatever extent you can and building on that, avoiding risk factors like tobacco and alcohol or, smoking anything really, exposing ourselves to smoke and secondhand smoke and limiting alcohol consumption, managing stress naturally, going to the doctor and getting regular checkups and not avoiding or neglecting your symptoms or your body, but making sure that you are keeping tabs on what's going on with your health, even if it's not an emergency, even if it's just something to be aware of for you, gives you knowledge about your body and empowerment. Paying attention to yourself, paying attention to your health, paying attention and facing, we all live in an aging body. We're all aging. And so if a history of bad health habits or bad habits have kind of caught up with you, or genetics have caught up with you, or some kind of negative event or trauma or injury has kind of caught up with you, and now all of a sudden you're facing, the stress, the overwhelm, symptoms that are either confusing or painful or difficult to pinpoint. It really, part of that really is paying attention and getting on board with what you're going to do to address them, as opposed to, avoiding. Definitely getting enough sleep, practicing, good hygiene, cleanliness, brushing teeth, flossing teeth. Our oral care is extremely important, and I'm somebody who has many crowns. I've broken many, many teeth from an accident that happened to me in my early 20s, and so I know the complications of the virus and the bacteria that can occur as a result of oral health issues and dental issues. Limiting exposure to environmental toxins, so this is air pollution and allergens and pesticides and chemicals, and just being aware. This is definitely part of chronic disease prevention. And staying informed, advocating for your health, being putting yourself at the driver's seat and seeking advice from knowledgeable healthcare professionals, but also taking responsibility and control for something that you don't think is working for you, and staying informed about the advancements in preventive medicine. Also advocating, some people want to get involved, more at the political level, advocating for policies and initiatives that promote public health access. And so public health does play a role in kind of community health, chronic disease prevention. So that's where you get into, well, I'm just going to say it no matter how you feel about it, but like vaccine campaigns, anti-smoking campaigns, condom usage, or safe sex of any type. So these tend to be where public health comes in to intervene, I should say, on chronic disease prevention. On the personal level, as I mentioned, it is more about paying attention to your own situation, to your own health, and noticing when something changes about your health, noticing when you're not feeling yourself or well, paying attention to being proactive, and educating yourself on the whole 360 experience and opportunity to do something better for yourself that's going to improve your health. So we're not just in the business of killing or destroying disease process. We really have to work with our body, because it's our body that is involved in the process of either preventing or treating disease. And so we can't just be like fighting against our body all the time. We really have to learn to accept it and to move forward positively in a nurturing way with ourselves, because it is ourself. So I hope that this has helped you and shed some light on what we'll be covering in this channel and in this group. And if you have any questions, please do tune in. And I think that that's basically all for me. Again, I am Millie Lytle, Dr. Millie Lytle. I'm a licensed naturopathic doctor. I have my master's in public health. I have a background of training in mindfulness, hypnosis, psychotherapy, cognitive behavioral therapy, and I'm looking forward to connecting with you here. Have a wonderful day.